Okay, we are on the top of the hour, and Alcor is pleased to welcome you all to today's webinar. Alcor is a global cloud advisory and implementation services company serving Fortune 500, government agencies, and other leading organizations in multiple industry verticals across the Americas, Canada, and India. Alcor is a ServiceNow Elite partner, and we also partner with leading technology companies including AWS, Oracle, Microsoft, FireEye, Okta, Incorta, 3C Logic, Celonis, OneTrust, and others. We advise leading businesses on cloud platforms, architecture, enterprise service management, and integrating IT service delivery. We also provide business process consulting to capture, re-engineer, and improve processes that can easily be automated to deliver real value. The Alcor consulting team has excellence in business strategy, cloud technology, and organizational change management. Our ongoing webinar series is designed to inform, enlighten, and start discussions within your own organizations. If you require any additional information after listening to today's webinar, please reach out to us through our website www.alcortech.com. It's www.alcortech.com. We have time reserved at the end of the webinar for Q&A, so please feel free to type any questions into the question section of the webinar dashboard. Today's webinar topic is Business Analytics in Healthcare, a case study, presented by Meenakshi Srivastava. Meenakshi is a lead consultant for BI and analytics practice at Alcor Solutions. She comes with a strong consulting and project management experience in IT-enabled services for Fortune 500 clients in healthcare and finance domains across the globe. She has wide experience of data engineering and BI technologies while implementing enterprise solutions for her clients. Meenakshi has a total professional experience of 14 years, and she has been instrumental as a DWBI architect and project manager. I will now turn the webinar over to Meenakshi. Are you there, Meenakshi? Could you take the webinar ahead? Looks like we have some technical difficulty. Just give me a moment. Sorry for that, guys. Meenakshi is online. I request Meenakshi to take the webinar ahead.
Yeah. So thanks, Sheetal, and hello, everyone. Today, I'm going to talk about analytics in healthcare. Although analytics is not new to healthcare, but now it has taken a significant leap forward with growing adoption of big data and machine learning algorithms. The tools are much more powerful, and so are the results. The results are actually very informative now. One of the most useful machine learning tools is predictive analytics algorithms, the application and benefits of which will be talked throughout the session. Now let's look at the agenda for today. We'll touch base upon future state of analytics in healthcare, the tools and technologies that are making it happen, traditional BI, predictive analytics, no ETL, SaaS BI, a touch point on how analytics can be applied in diagnosing dementia with machine learning. Purpose is to explain the application of analytics and not the analytics itself. So not the right forum for folks looking for a deep dive. Lastly, we'll talk about challenges in current state. Before going further, let's take a debrief of how deep technology has entered or carries the potential to impact healthcare industry, to celebrate or to experience the reality of human existence. We do visit hospitals, healthcare centers once in a while, right? Whether it is for ourselves, friends, family members, or as a staff, we do feel that technology has helped us, isn't it? Most of us are leveraging the benefits of EHR systems, which is nothing but electronic health record. It is the most widespread application of big data in medicine. Every patient has his own digital record, which includes demographics, medical history, allergies, laboratory tests, results, etc. And this information is available not just for the patient, but the provider too. This is nothing but big data. This data is very significant in terms of deriving critical insights that can then be used to provide better care. Such data-driven findings can help in picking up the warning signs for future illness in case they arise. So treating any disease at an early stage is far more simple and less expensive. So the takeaway is that prevention is better than cure. And that is where analytics can take us forward to. It would also help us in fighting the silos problem. So what is that problem? So the silos problem that a patient's data has, it is everywhere. It is in bits and bytes. It is archived in hospitals, clinics, healthcare centers, but data is not communicating to each other, which is very important for analytics. With today's technology, we can integrate data which is spread across public and private sources. It would also enable us to reduce cost of treatment, predict outbreaks of epidemics, avoid preventable diseases, and improve the quality of life in general. So we'll move ahead. Above all, it's also about patient's experience, isn't it? So let me correct it. Patient is now a customer, right? Or a client maybe. So user experience is the mantra in today's time, and healthcare is no different. It is treated as a service, just like hospitality service. In the last decade, that is the change that we are seeing. So it has become a service, just like any hospitality service. There is close intersection between the two, whether it is because of quality clinical outcomes, it is about controlling operational cost, minimizing employee attrition, customer and stakeholder satisfaction, infrastructure, logistics, right? And that is what is leading us to the future. That is the roadmap that is going to lay the roadmap for us. Major drivers I have mentioned here are digital networking, operational cost, faster and accurate treatment, patient experience or involvement, and health warnings. So let's talk about digital networking. Physicians, healthcare providers, clinicians, right? They are part of formal and informal networks wherein they share insights, information, experiences, clinical decisions at times. We all know that. This informal network can be leveraged using big data and analytics. But how? The point is that this network is fragmented across geographic locations. If healthcare organizations could digitally map these relationships within their own geographic areas to respective patient members, right? It is not only for the benefit of the provider, but also for the patient, because knowledge experience would become multiple folds. The tighter the shared patient and physician network is, With physician at center of network, average cost and clinical performance would average cost would go down, would get lower, and clinical performance would get better. Now, what about operational efficiency? As, as an example of operational management, insights from predictive analytics can help optimize staff levels. So how is it? Managers can access statistics collected over years about patient staff ratio at different times in years, and let's say also in case of natural calamities. This information equips them to know how many staff members they should plan for a given healthcare facility. Utilizing historical data along with overflow data from nearby facilities, population data, demographic data, reportable diseases, and seasonal sickness patterns. When these are fed to a predictive analytics model, it can generate those useful statistics, which can be used by the management or the senior executives. Operational efficiency can also be increased as the technology exists to assess weather patterns, such as ambient temperature readings, and calendar variables such as day of the week, time of the year, and public holidays. To forecast patient seeking care, one can estimate the volume of walk-in patients that a facility can handle, allowing them to recruit and roster staff accordingly. So this is going to enable the operations. In turn, this all allows overall improvement of service delivery to patients, helping to ensure that they receive the best possible quality of care. Analytics can support providers to find the correlation in the patient's data, association of the symptoms and familiar antecedents of the symptoms. It allows us to explore the impact of different factors on the course of treatment and examines the possible influence of past and current diseases. Thus, it plays also a significant role in accurate and faster diagnosis, and not just the diagnosis, but also the treatment. We talked about the future roadmap, but what are the tools and technologies which are going to enable this? We have listed traditional BI, predictive analytics, no ETL, SAS BI. So while traditional BI is based on descriptive analytics mostly, predictive analytics is a discipline that utilizes various techniques including modeling, data mining, and statistics, as well as artificial intelligence to evaluate historical and real-time data to make predictions about the future. To meet this industry demand of big data in real time, new techniques and tools are emerging like no ETL, SAS BI. So no ETL is your go-to strategy for real-time reporting. While it is relatively new, but will prove useful as it can dynamically adjust the predictive algorithms in line with new discoveries and insights. Whereas SAS BI, it promotes on-cloud hosting of application with subscription-based user access to BI or enterprise dashboards. Let's explore how predictive analytics can play a warning alert for critical ailments like dementia. Clinical studies have proven that dementia disease initiates 10 to 15 years before clinical symptoms are visible. The symptoms are mostly in form of cognitive impairment, but it is difficult to detect in the early stages. So majority of AD patients across the globe do not get proper care at the right time. If it can be predicted earlier, then it will be valuable in designing a proper clinical trial and proper care to the patients. Now, various approaches have been discussed throughout the years to find a possible solution for the problem. The aim of this case study is to inform how analytics works and can be applied in real life scenarios. We'll talk briefly about the concept of predictive analytics. So predictive analytics can be both supervised or unsupervised. In supervised learning, it is based on logical theories to fit a hypothesis. A set of rules and processes are developed into a formula that undertakes a calculation and is known as an algorithm. Predictive analytics can also be based on unsupervised learning, which does not have a guiding hypothesis, but it applies algorithm to see patterns and structure in data. Right? This is further clustered into groups or insights. In unsupervised learning, the machine may not know what it is looking for, but as it processes the data, it starts to identify complex processes and patterns that a human eye may never be able to see or identify. That is why it adds significant value to researchers who are continuously looking for something new. Besides, both supervised and unsupervised predictive modeling techniques are very useful in a well-rounded application. The first step is to know the data. I collected data from publicly available forums of around 1 lakh patients. The independent variables listed in the data set included demographic and health records of the patient. Few examples are age, gender, sexual orientation, education, employment status, location, living situation, and health issues. For example, whether the patient has diabetes, high blood pressure, any neurological disorders, or even a drug abuse disorder, to name a few. The initial hypothesis is whether the factors listed here can play a role in causing dementia. So that is our hypothesis to start with. Let's see if we can get any clear patterns in the data. I plotted education status against the patients who are already diagnosed with dementia. You would notice that most of the patients, right, most of the patients were high school passed. But can this be a hypothesis? Can this be a basis of a hypothesis? We cannot really say. If you look at the race, people of certain race may have similar eating habits and are habitant of certain regions which can contribute to dementia due to environmental factors. So this is also an area of interest. This we have covered in the next slide. But what about other factors? So what I'm trying to do here is to nail down specific exploratory variables that have higher possibility of impacting the dependent variable. And what is that dependent variable? We are talking about true or false, whether a patient has dementia or not. Continuing with the univariate and bivariate analysis, employment and not having willingness also for any kind of work or engagements may lead to sedentary lifestyle, less social involvement. The bubble graph here does show a correlation that people with a sedentary lifestyle had higher chances of dementia. Similarly, 63% of dementia patients were also being medicated for high blood pressure. There are many such correlations that can be derived in the data set. So in order to verify the initial hypothesis, it seems that this case seems to be a typical classification problem, wherein we would want to see the impact of various clinical and non-clinical evidences on the dementia episode. This I'm applying factor analysis or principal component analysis along with random forest to predict patients with dementia and reasons behind it. There are obviously other regression and predictive modeling techniques which can be applied for better accuracy as in a full-fledged case study. But like I said, the focus is more on general application and not the deep dive. So principal component analysis, what it is a technique used to bring out strong pattern in a complex data set. It is particularly helpful in the case of wide data sets, wherein we have many predictor variables and one dependent variable like the sample we have. It basically simplifies the data set by turning the original variables into a smaller number of principal components. So here is the same thing that we are seeing over here. I could identify 4 major components that would cause dementia. These are cardiovascular health, neurological disability, blood pressure, and substance disorder. Quick note on random forest modeling. It is based upon ensemble technique and involves constructing multitude of decision trees at training time. Each tree gives a classification and we say the tree votes for that class. The forest chooses the classification having the most votes over all the trees in forest. In a very simple way to explain it, now the performance of the random forest model is evaluated on basis of classification error rate. In a classification problem, the percent of cases wrongly classified is called classification error. Using predictor model, we can estimate the probability or predict the class. This can be done using confusion matrix, which gives positive predictor values. It is nothing but the proportion of positive cases that were correctly identified. It also provides negative predictor values, which is the proportion of negative cases that were correctly identified. So people who had dementia, they were correctly identified, and people who did not have dementia, they were also correctly identified. So that is how the classification, that is what classification error identifies. The lower the classification error rate, higher is the model accuracy, resulting in a better model. The current RF model that I applied is giving us 8% classification error rate, which is good enough. Other performance measure criteria is Gini coefficient. We can simply say that higher this coefficient, the more unequal the distribution is. Gini above 60% is a good model. For the given data set and the model that I built, the Gini coefficient is 76%, which is good enough, but obviously can be tuned further. There are other model performance measures considered, as well, like KS, which came out as 68%, area under the curve, which is 82%. So this is what was the outcome of the model performance. To conclude the case study, we can say that traumatic brain injury, blood pressure, and cardiovascular health were the major parameters that contributed to dementia on the basis of variable importance, which is derived through the random forest. This was a very quick, quick example of how analytics is applied in real life scenarios of healthcare.
Thank you, Meenakshi.
Sheetal, I have
I
one more
think we
slide.
still have challenges ahead. I see that. Please continue.
Yeah. So without the challenges, so this could not have been completed, right? So healthcare has been based on evidence-driven clinical practices and ethical standards in research. But with the emergence of these new technologies, such as the use of analytics we have been talking about, the point where a machine process can replace a human mental process is not clearly regulated or even controlled by industry standards. Government health agencies, doctors, and primary health givers need to be aware of the risks, and they should agree on level of assurance as society continues to move into this new era of supplemented decision making. And at times it may be getting replaced by evidence from digital technologies. Besides, there can also be privacy issues because now we have data sharing on cloud and other platforms for research. So this was all about analytics and healthcare. Sheetal, over to you.
Thank you, Meenakshi. Okay, there are a few questions that I will get to you in a moment. As a reminder, please use the question section to ask a question on today's topic. You can type in your questions in the question section of the webinar portal. Coming to the first question, Meenakshi, what are the challenges, if there are any, of applying analytics in healthcare?
Yeah, so like I mentioned, Sheetal, it is about the lack of skills, non-existing regulations, or the lack of industry standards, supplementing decision making. These are the major challenges ahead.
Right, right. Uh, Besides this, we have another question. How is business analytics in the current generation? How is it different from traditional BI?
Mhm. So traditional BI was more about descriptive analytics, what has happened. So getting the trends from, what has happened in the past. But it did not, it told us that, okay, what has happened and, what should not have happened, but it did not tell us what can we do to not let that happen in future. So
Okay,
and what can happen in future, so which happens in case of predictive analytics, and it is pretty leaps ahead from descriptive analytics.
right, right, right. Cool. I don't see any more questions coming in. Thank you, Meenakshi, for your in-depth case study for today on business analytics in healthcare. Uh, the recording of today's webinar will be available on our website, www.alcortech.com. We will also be sending you a link to the recording via email. All the people who registered and attended will get a link to the recording. Thanks, Meenakshi, again, and thanks everybody for joining. We would love to see you again in our next webinar. Thank you.
Thanks. Yeah, thanks everyone. Bye.